Welcome to Providing Care in an Emergency, a review of first aid and wound care provided by American Way University. My name is Angie Danielski, and I have developed this course as part of continuing education hours required for caregivers in the assisted living setting. In Part 2 of the presentation, we will discuss several sudden illnesses, including chest pain and heart attack, breathing emergencies, stroke, seizures, and diabetic emergencies. We will also discuss weather-related emergencies. When caring for residents, it is important to know the signs and symptoms of many common emergencies that are often associated with advanced age. Knowing common illnesses can help to prevent further complications. Over the next several slides, we will go over what to look for in residents who may be experiencing chest pain, which can be a symptom of a heart attack, a breathing emergency, which can occur if there is swelling or blockage of the airway, a stroke, what to look for when there is lack of oxygen to the tissues in the brain, a seizure, which is uncontrolled electrical activity in the brain, and a diabetic emergency, either high or low blood sugar. Anytime a resident complains of chest pain, caregivers should always act as if the resident is having a heart attack. Signs and symptoms of a heart attack may include chest pain, especially feeling like the pain is crushing, squeezing, or that there is pressure on the chest. Another symptom is shortness of breath or difficulty breathing, where a resident feels like they cannot catch their breath. A resident can also exhibit profuse sweating and flushed skin. The pain a resident experiences may radiate or move to the left arm, the jaw, especially on the left side, and pain between the shoulder blades on the back. A feeling of fatigue or extreme tiredness can also be experienced. Anytime a resident exhibits any of these symptoms, you should immediately call 911 or activate your emergency response system. Breathing emergencies can occur due to many reasons, such as asthma, COPD or emphysema, bronchitis, anaphylactic allergic reactions, or airway obstruction. Symptoms of difficulty breathing can include breathing that is too shallow, too deep, too rapid, or too slow. Color changes to the skin can also indicate a breathing problem, especially if the lips or around the mouth or nail beds appear to be blue or purple. Abnormal breath sounds or absent breath sounds may indicate a breathing problem as well. Normal breathing is silent and occurs without any effort. If someone is using accessory muscles or any other muscle aside from the diaphragm to breathe, it is a sign of a true breathing emergency, and the emergency response system should be activated. In the next slide, we will discuss airway obstruction. An airway obstruction can either be partial or complete obstruction. Partial obstruction occurs when an object is lodged in the throat, but air can still pass. If a resident is able to talk or cough, encourage the person to keep coughing in order to try to dislodge the object on their own. A complete obstruction occurs when an object is completely blocking the airway and air cannot pass. The resident in this instance would not be able to speak or cough. In the event of a full obstruction, caregivers should begin alternating between back blows and chest thrusts. We will see a video demonstration of this procedure to assist a resident who is conscious and choking. Recognizing a stroke is important to get the resident to the hospital in order to receive the care that they need. A simple way to remember how to recognize a stroke is to think fast, or F-A-S-T. The F stands for face. Ask the resident to smile. If the resident is having a stroke, the smile will be uneven on one side and one side of the face may droop. The A stands for arms. Lift the resident's arms straight out in front of them and then tell the resident to close their eyes and to keep holding their arms out while you let go. If the resident is experiencing a stroke, one arm will fall down to the side. The S is for speech. Ask the resident to say a simple phrase like "The sky is blue in Cincinnati." If the resident is having a stroke, the speech will be slurred. Lastly, the T stands for timing. When was the last time that someone saw the resident acting normal? It is important to estimate the time since the resident was last seen normal so that the hospital can determine the course of treatment. Only one of these signs needs to be present in order to consider it positive and that the resident is having a stroke. If any one of these is positive, caregivers should activate the emergency response system immediately. If a resident begins having a seizure, the caregiver should allow the seizure to happen and avoid holding the resident down, as this can cause injury to the resident since they cannot control their body movements. It is also important to assist the resident to the floor so that they do not fall off of the chair, potentially injuring themselves. Additionally, clear the area around the resident so that they do not hit into anything during the seizure. Turning a resident on their side can be helpful to help maintain an open airway and allow any secretions to drain from the mouth so that a resident does not choke on them. Lastly, remember to never put anything in the resident's mouth who is having a seizure, as they may bite the object off and choke on it. Anytime a resident is having a seizure, make sure to activate the emergency response system. Since diabetes is common among assisted living residents, it is important to understand what to look for in a diabetic emergency and how to respond. Symptoms of low blood sugar include cool and clammy skin, confusion, and dizziness. If a resident has low blood sugar and is alert, give the resident a source of sugar to help increase the blood sugar level. If a resident is not alert, activate the emergency response system immediately. Symptoms of high blood sugar include hot, dry skin, fruity smelling breath, and confusion. If a resident has high blood sugar, activate the emergency response system immediately. As residents age, they are more susceptible to weather-related illnesses, either heat or cold. Heat-related emergencies include heat cramps, where muscles become painful with movement, heat exhaustion, where residents may complain of dizziness, extreme thirst, headache, and nausea, and heat stroke, which has similar symptoms as heat exhaustion but are more severe and may include altered levels of consciousness. Whenever a resident complains of any heat-related illness, it is important to get the resident indoors immediately to avoid further symptoms. Residents can also be cooled with either cool water or ice. Cold-related emergencies can include frostbite, where skin tissue and cells are actually frozen, which can cause extensive damage and cell death to the affected area, as seen here in this picture. Another cold-related illness can also be hypothermia, where a resident's core body temperature decreases, which can cause altered levels of consciousness. Residents experiencing either of these cold-related emergencies need to be brought indoors and any wet clothing removed. Rewarming should occur slowly, and any areas of the skin that have frostbite should not be rubbed to avoid further damaging the skin. You have reached the end of Part 2 of the American Way University training of Providing Care in an Emergency, a first aid and wound care review course for caregivers.